Okay, I'm going to tell you a brief little story. Starts off kind of sad, but it has a very happy ending. So I had a patient this week, and as chiropractors, we take a very detailed history. Not only do we want to remedy your pain, but we want to take that a step further and figure out what is causing your pain. What are you doing in your daily routine that's causing pain, that's causing structural abnormalities that's leading to this inflammatory cycle of pain. So when I was talking to this guy, a couple of the questions we ask are what makes the pain worse, what makes it better? And when I said what makes it worse, the guy literally almost like teared up and he said, I can't play and chase my little 3-year-old around like I want to, bending over, picking him up, that exacerbates it, causes more pain, and I mean, obviously, it's heartbreaking. Those are things that, his pain by now is affecting his activities of daily living, and specifically the ones, regarding his family. So two things. Number one, pain does not have to be a byproduct of aging. Too many people think that because they're getting older, pain is just the norm. No, that doesn't have to be true. Certainly of this patient of mine who was in his early 40s. So that's number one, pain does not have to be a byproduct of aging. There are things that we can do to fix that. Number two, you have to ask yourself sometimes, who does your health really belong to? I mean, men especially can be very narcissistic with their health. They're like, we're tough, we can handle it. But you have to consider that your health also belongs to your loved ones. His health belongs to his 3-year-old that he's having difficulty playing with. So not only do you owe it to yourself to alleviate these pain situations, but you owe it to your family and your loved ones. So that's what we do as chiropractors. Number one, our first goal is to get you out of pain, and we want to do that as quickly as possible. That's goal number one. Number two, we want to know what's causing this pain. We want to know what's wrong with you structurally, and so we can specifically fix that so it's not going to cause you pain in the future. So if you have some similar situations, if your neck pain, your low back pain is affecting your activities of daily living, give us a call. We can help.